I am Dr. Leana, and before you scroll past this, I need you to stop for just a moment, because what I am about to share with you is something your doctor may never sit down and explain in the way that it actually needs to be explained. Not because they don't care, but because they simply don't have the time. And in that gap, between what you know and what your body is already doing, lives the most dangerous kind of risk. The kind you cannot see coming. Most people believe the heart gives dramatic warnings. A sudden clutch of the chest. A collapse. Something unmistakable that sends you rushing to an emergency room. And yes, sometimes that happens. But here's the part that nobody talks about enough. That is almost never how heart trouble begins. The heart does not usually shout. It whispers. Quietly, persistently, in a language most of us have never been taught to read. And because those whispers feel familiar, feel explainable, feel like things we can simply push through, we ignore them. For months, sometimes for years. And by the time the shouting starts, the damage has already been building in the background for a very long time. So today I want to teach you that language. I want to walk you through 5 signals that your heart may already be sending you. Explain exactly what is happening inside your body when each one appears, and help you understand why the combination of these signals is far more important than any single symptom on its own. Because here is what I know after years of working with patients. The people who catch heart problems early are not the ones who got lucky. They are the ones who knew what to listen for. Let us start with something almost every person over 50 has experienced, and almost every person over 50 has dismissed. Fatigue. But I am not talking about the tired you feel after a long day at work or a weekend where you pushed yourself a little too hard. I am talking about something different in quality. A tiredness that greets you in the morning before the day has even started. A heaviness that settles into your limbs after tasks that used to feel effortless. Walking from one room to another, carrying a bag of groceries, climbing a single flight of stairs, and suddenly you need to sit down, catch yourself, take a breath that feels a little longer than it should. Most people say the same thing when this happens. They say, I am just getting older. And I understand that. Aging does change energy levels. That is a biological reality. But here is the distinction that matters enormously, and this is the part your body needs you to hear. True age-related fatigue changes gradually over years. What I am describing comes with a different texture. It is disproportionate. It does not match the effort. And underneath it, something specific is happening at the cellular level. Your heart's primary job, the job it does every second of every day without rest, is to push oxygen-rich blood to every single tissue in your body. Every muscle fiber. Every organ, every microscopic cell. And inside each of those cells are structures called mitochondria. These are your body's energy factories. They take in oxygen and nutrients and convert them into the fuel your body runs on. They are extraordinarily efficient when everything is working correctly. But they are also deeply sensitive to supply. When the delivery of oxygen drops even slightly, mitochondrial energy output drops with it. And the result is not subtle. Your entire body begins to feel like it is running on a battery that refuses to charge past 40%, no matter how much you sleep, no matter how much you rest. This is what doctors call reduced cardiac output. Your heart is simply not pushing enough blood forward to meet your body's demands. And rather than sounding an alarm, your body quietly begins to compensate by doing less, by conserving, by slowing down. It is smart in the short term. It is dangerous when it becomes the new normal. So I want you to sit with this question honestly. Has your energy shifted in the past year in a way that does not quite make sense? Not dramatically, just quietly, gradually, persistently less than it used to be? Because that shift may not be age. It may be the first whisper. Now let us talk about what often accompanies that fatigue, and sometimes appears even before it becomes obvious. Breathlessness. In the beginning, it is easy to rationalize. You climb the stairs a little faster than usual and feel winded. You walk briskly to catch a bus and have to pause when you arrive. You laugh hard and notice it takes a moment to recover. Nothing that feels alarming. Nothing that would send you to a doctor. So you file it away. You assume you are out of shape. You assume you need to exercise more. And you move on. But then something shifts. The breathlessness starts appearing in situations where it did not before. During a conversation. After a light walk. While doing something that requires almost no physical effort at all. And then, the one that should stop you completely. It starts happening when you are lying down. You may not even register it consciously at first, You just find yourself adjusting your pillow, adding another one, propping yourself up slightly higher at night without knowing exactly why. You sleep better that way, so you keep doing it. But I want you to understand what that small adjustment actually means, because it is one of the most telling signs a cardiovascular system can produce. When your heart is struggling to push blood forward efficiently, that blood begins to back up. It has nowhere to go but backward through the system. And the place it backs up into is the lungs. The tiny, delicate blood vessels inside your lung tissue experience increasing pressure. And under that pressure, fluid begins to seep out of those vessels and into the lung tissue itself. Now your lungs, which should be light and open and full of air, are becoming partially waterlogged. And breathing through waterlogged lungs is exactly as difficult as it sounds. Less space for oxygen to transfer. More effort required for every breath. And when you lie flat, gravity can no longer help keep that fluid lower in your body. It redistributes toward your chest. The pressure increases, and so does the breathlessness. This is why sleeping with extra pillows is something cardiologists ask about specifically during evaluations. It is not a quirk. It is a clue. And it is one that points directly to the pressure dynamics inside your circulatory system. Now, because your body is constantly trying to solve problems it was not designed to handle indefinitely, it calls on your kidneys for help. And this is where the third warning sign enters the picture in a way most people never expect. Swelling. At the end of the day, you take off your shoes and your feet look slightly puffy. Your socks leave indentations around your ankles that take time to fade. You press your finger into the top of your foot and the dent holds for a moment before filling back in. Maybe you write it off as standing too long, or a salty meal the night before, or just something that happens when you get older. But here is what is actually happening underneath the surface. When your kidneys sense that blood flow to them has decreased, they do what they were designed to do under normal circumstances. They assume the body is dehydrated or low on blood volume, so they activate a system called the renin-angiotensin system, a hormonal cascade whose entire purpose is to retain sodium and water in order to raise blood volume and pressure. In an emergency dehydration scenario, this is a life-saving response. But when it is triggered by a failing heart, it becomes a trap, because now your body is holding onto fluid it does not need. And that excess fluid, unable to stay in the bloodstream under the increased pressure, leaks out into the surrounding tissues. Gravity pulls it downward, into your legs, your ankles, your feet. And what you see as swelling is actually the visible evidence of your circulatory system being overwhelmed. And here is the part that makes it genuinely dangerous, rather than just uncomfortable. That retained fluid increases the total volume of blood your heart must move. More volume means more work. More work on a heart that is already struggling means more strain. More strain accelerates the weakening. So the compensation becomes the very thing that worsens the problem. It is a cycle that your body cannot break on its own once it has started. And the longer it runs unaddressed, the further the heart falls behind. Now your heart, under this mounting pressure and strain, begins to experience something in its electrical system as well. And this produces the fourth warning sign. Sensations in the chest that feel wrong. A flutter. A brief racing that comes out of nowhere and disappears just as quickly. A beat that seems to skip or land slightly off rhythm. A thudding that feels more forceful than usual, or a moment where your heart seems to trip over itself. Your heart's ability to beat in a steady, coordinated rhythm depends on its electrical conduction system remaining stable. Each beat is triggered by a precise electrical signal that travels through the heart muscle in a specific sequence. When the heart muscle becomes stretched due to fluid overload, or stressed due to insufficient oxygen delivery, or remodeled due to long-term strain, that electrical system becomes unpredictable. Signals misfire. Timing gets disrupted. The heart compensates for its reduced pumping efficiency by beating faster, or it develops areas where the electrical signal moves differently than it should. The result is a heart that is not only weaker, but less coordinated. And a heart that is less coordinated pumps even less effectively than its weakened state would suggest. These two problems compound each other. And what began as a circulation issue becomes an electrical issue as well, and the two together create a situation that is significantly more complex than either alone. What makes this warning sign especially tricky is that many people experience these sensations occasionally even with a completely healthy heart. Stress, caffeine, poor sleep, anxiety can all produce a skipped beat or a brief flutter, so it is easy to dismiss. But the key is pattern and context. When these sensations become more frequent, when they appear alongside the other signs, when they are not clearly tied to an obvious trigger, that is when they stop being benign and start being information worth acting on. And now we come to the fifth warning sign, the one that surprises people most consistently, the one that gets misattributed more often than any of the others: a cough. A persistent, nagging cough that does not quite go away. That seems to get worse at night. That might occasionally produce a small amount of white or faintly pink-tinged mucus. And that, if you are being honest with yourself, has been around longer than you would typically tolerate a cough without seeking help, precisely because it never feels dramatic enough to worry about. You blame dust, allergies, a cold that never fully resolved, something in the air at this time of year. And so it stays. Weeks pass, sometimes months, but here is what is actually happening. The same fluid that is building up in your lungs under increased vascular pressure does not just make breathing harder. It also irritates the airways directly. The bronchial passages, the delicate linings of your respiratory system, respond to that irritation the same way they respond to any foreign substance or allergen. They trigger a cough reflex. And when you lie down at night and that fluid redistributes toward your chest, the irritation intensifies. The coughing becomes more persistent, often worse in the early hours of the morning when you have been horizontal the longest. A cardiac cough, as it is known clinically, is one of the body's most underappreciated warning signals. Patients sit in examination rooms having coughed for 4 months and tell their doctors they think it might be seasonal. And sometimes it is. But when a persistent cough appears in the company of the other signs I have described today, it is no longer a separate and minor annoyance. It is the final piece of a very coherent and urgent picture. So let us hold all 5 together for a moment, because this is where everything becomes clear. Fatigue that does not match your activity level. Breathlessness that is beginning to appear in unexpected situations, especially when lying flat. Swelling in your legs, ankles, or feet that appears through the day and fades overnight. Occasional irregular or unusual heart sensations. And a cough that refuses to resolve and worsens at night. Individually, each one of these has an easy explanation. Together, they tell a specific biological story. A heart that is losing its ability to push blood forward efficiently. A body compensating with fluid retention that increases the burden on an already struggling organ. Lungs that are under pressure and irritated. An electrical system that is becoming unstable. And a cascade of effects that will continue to worsen without intervention. Gradually, quietly, and often without a single dramatic moment to mark the turning point. Now here is what I need you to understand about age, because it matters to everything I have said. After 50, your blood vessels naturally lose some of their flexibility. They become stiffer. The heart has to work harder to push blood through them. Low-grade inflammation increases throughout the body. Recovery from physical and physiological stress slows down. And all of this means that when the heart begins to struggle in this environment, the effects are amplified. The compensations are less effective. The timeline is shorter. And the window for meaningful early intervention is more important than it has ever been. This is not meant to frighten you. It is meant to give you the one thing that changes outcomes more reliably than almost anything else: awareness. Because simple diagnostic tools exist right now that can reveal what is happening inside your cardiovascular system with clarity and precision. A blood pressure measurement, an electrocardiogram to assess your heart's rhythm and electrical activity, an echocardiogram to look directly at how your heart is functioning, how well it is pumping, and whether the walls and valves are responding normally. These are not extreme or complicated procedures. They are standard tools that produce real information. And real information leads to real decisions. Your daily habits also matter far more than most people realize. Not as cures, but as meaningful contributors to how much strain your heart carries every single day. Regular movement, even something as simple as a daily walk, genuinely improves circulation and supports oxygen delivery throughout the body. Managing sodium intake helps reduce the fluid retention cycle. Keeping blood sugar in a healthy range protects the blood vessels from the slow cumulative damage that high glucose causes over time. Sleep, stress management. These are not peripheral suggestions. They are direct inputs into your cardiovascular health, and their effects accumulate over years in both directions. Your heart is not failing quietly because it stopped caring about you. It is signaling because it is doing everything it can to keep you going. The fatigue is a signal. The breathlessness is a signal. The swelling, the irregular rhythm, the cough, they are all signals. Your body has been speaking this language for as long as you have been alive, and today you are a little more fluent in it than you were before. The people who protect their hearts long term are not the ones who were somehow born more resilient or more fortunate. They are the ones who paid attention when the whispers were still quiet enough to respond to, before the compensations compounded, before the cycle became harder to interrupt. So I want to ask you one final question, and I want you to answer it honestly, not for me, but for yourself. Has your body been trying to tell you something? Has there been a pattern, subtle and easy to dismiss, but persistent enough that some part of you has noticed it? If the answer is yes, let that be enough to make one appointment. One conversation with a doctor. One set of numbers on a page that gives you clarity. Because awareness is not just the first step toward prevention. Sometimes it is the only step that matters.